Welcome to Connective Care Education.
Today we are going to look at Unit 003, Learning Outcome 3, Personal Care and Continence Management. Part 1, Personal Care. What is personal care? Personal care is a broad term for care related to personal hygiene. The dictionary defines personal care as help given to elderly or infirm people with essential everyday activities such as washing, dressing and meals. It refers to assistance with daily tasks such as showering, bathing, dressing and undressing, toileting, including the use of a commode, applying creams and lotions, oral hygiene and toothbrushing, makeup and hair care, shaving, foot care, changing incontinence pads, moving in bed to avoid pressure sores, changing or maintaining a stoma or catheter bag, and maintaining nutrition or feeding. Where personal care is provided, it is tailored to the needs of individuals and needs to be recorded in a care plan, which will also support and encourage the independence of the individual and give psychological and emotional support. Ways to establish an individual's preferences in relation to how they are supported with their personal care. When providing personal care, it is important to respect the dignity, choices, wishes and preferences of individuals. Individuals should be empowered and remain in control of what is happening to them. Choice and control are key aspects of promoting dignity. This can be done in a number of ways. You can speak to the individual before personal care about their preferences. Speak to the individual after personal care about how their needs have been met and any changes they would like. Speak to the individual about their changing care needs. Speak to family or other carers involved. You can look at previous documentation in relation to the individual's preferences and habits. You use alternative means of communication, for example, pictures. We can find out about religious or cultural requirements. We can read care plans and risk assessments. We can discuss specialist equipment used with an occupational therapist, and we can work with advocacy services. Protecting the privacy and dignity of an individual when they are being supported with their personal care. It is important that the privacy and dignity of individuals is respected at all times during personal care. This can be supported in a number of ways. We can ensure a confidentiality policy is in place and implemented. We can restrict access to personal information, including financial records. We can provide training for staff, respect privacy and ask for permission before entering a private space. Support dignity, for example, during a strip wash, we should cover the bottom half of the body while the top half is being washed. We can provide the individual with choice and different options. We can communicate with the individual during personal care routines as an equal. We can show respect for an individual's personal belongings. We can use do not disturb signs. We can ask for an individual's permission to carry out personal care routines. We can ensure single-sex toilet and bathroom facilities are available. We can provide en-suite toilets and bathrooms. We can dress an individual appropriately to maintain dignity and let them choose their clothing. We can use pads where there is incontinence. and we can make sure that food looks and tastes nice. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 3, Worksheet 1. Part 2, Continence. What is continence? Continence refers to control of the bladder and bowel. It is the ability to retain urine or feces until the proper time or place for their release. A continent individual knows when they need the bathroom and uses it. Factors that may contribute to difficulties with continence include childbirth, being overweight, enlarged prostate or prostate surgery, stroke, neurological disorder, for example, Parkinson's disease and multiple sclerosis, spinal cord injury, diabetes, mobility issues linked to disability. This is referred to as functional incontinence. The individual is aware they need the toilet but is unable to get there independently. Dementia or memory difficulty, bowel or bladder infection, and a urinary tract infection, Crohn's disease, diarrhea or constipation, medication, alcohol and caffeine, smoking, changes with age, obstruction, family history, and drugs. Ways in which difficulties with continence can affect an individual's self-esteem, health, well-being, and day-to-day activities. Incontinence can be upsetting for both the individual involved and those around them. Incontinence can impact on work, exercise, sex, and social life, having a significant impact on well-being and self-esteem. Many individuals who have difficulties with continence also experience depression. If an individual is unable to exercise, this will impact on their weight, which may exacerbate continence problems. Daily routines such as housework and shopping can become a problem, leading to poor nutrition and living conditions. Individuals may feel dirty, worry that they smell, or their clothes are soiled and can become isolated and depressed or anxious. Feelings of frustration or anger may be displayed. Incontinence can affect performance and confidence at work and frequent toilet visits, which an individual may not feel comfortable explaining to their manager. It may limit choices of clothing, which will have a negative impact on self-esteem. Individuals who need the toilet frequently at night are not getting enough rest, which will affect concentration and lower the immune system, making them more vulnerable to illness. How an individual's beliefs, sexual preference, and values may affect the management of their continence. It is important that the different beliefs, sexual preferences, and values of individuals are respected in the management of continence to ensure they receive appropriate support. Gender, sexual preferences, beliefs, religion, and culture can impact on the wishes of individuals. If these are not considered and followed, it may result in social isolation and healthcare issues. Individuals from all backgrounds may experience embarrassment regarding continence issues and may not be willing to discuss them with a professional of the opposite sex. They could also feel uncomfortable undressing in front of others. In some cultures, it is forbidden for women to expose their bodies to men apart from their husbands who they may not wish to discuss issues with. So they will avoid any physical examinations. Incontinence can have an effect on religion for some cultures, in particular Jewish and Muslim women, as it affects the need for cleanliness during prayer. Muslim women have a strong preference for female doctors. This is for cultural reasons. Barriers to communication and language differences may prevent discussion in regards to continence. If translators are used, individuals may be concerned about confidentiality. Individuals may be reluctant to use family members to translate because of embarrassment. Transgender men may struggle to find the appropriate toilet for them to use. However, things are improving in this area as there are now LGBT toilets in most city centres and buildings around the UK where younger members of the public frequent. Most further education colleges and universities offer these facilities. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 3, Worksheet 2. Part 3. Continence Management. Aids and equipment that can support the management of continence. A number of aids and types of equipment can support the management of continence and assist individuals in having a normal life. These include incontinence pads, disposable, available in supermarkets and pharmacies and can come in different sizes. Pull-up pants with built-in pads. Male continence sheath, which is a specialist device shaped like a condom that drains urine. A larger sheath can be used overnight. Absorbent bed pad, waterproof mattress protector, which is like a sheet with waterproof backing which can assist a good night's sleep. Chair protectors, so this is a pad with a waterproof backing to protect chairs and sheets. These can be used in addition to pads and pull-up pants. Catheters. These drain urine directly from the bladder into a drainage bag. It can be placed under clothing or over the bed. A catheter must be prescribed by a doctor or a health specialist. Commodes and bedpans can support individuals with mobility problems to get to the toilet quickly. Professionals that may help with continence management. A range of professionals may help with continence management. These include general practitioner who can review symptoms and underlying causes. Continence nurse or advisor, they can identify causes of difficulties and how they are affecting quality of life. They can create treatment plans and empower the individual to manage their care. Community nurse or practice nurse can help the individual access continence aids and products, as well as giving advice, for example, around hygiene. Occupational therapist, they can provide advice on adaptations and equipment. Continence physiotherapist, they will suggest exercises which can support bowel and bladder control. And you've got community health centre who can provide advice and guidance. Bladder or bowel specialist, so they will look at the disease, physical conditions and any surgical options. Pharmacist, they can provide advice and continence supplies. Ways to support individuals with their personal care and or continence management. Personal care routines would include personal hygiene, bathing, cleaning teeth, menstruation and continence management. During personal care routines, it is important to protect both the individual and the worker supporting them. This can be done in a number of ways. wearing personal protective clothing, using safe, appropriate equipment and materials, ensuring safe disposal of waste and soiled materials, ensuring changing areas are visible, ensuring workers or carers are visible and are not alone with individuals when receiving personal care, recording and reporting any concerns, marks or bruises, and ensuring there are no mobile telephones or electronic devices in the changing or toileting areas. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 3, Worksheet 3.